Welcome back to the Morning Blend. National Senior Health and Fitness Day is coming up next Wednesday. It's a great time to raise awareness of steps seniors can take to remain healthy and active. Here with helpful information about senior wellness, Healthcare Partners physician Dr. Alonge. Good morning to you and welcome.
Thank you.
It's great to see you. Now, let's talk about why it's so important for seniors to stay active and healthy as they age.
You know, as my patients, as they get older, they get all kinds of chronic medical conditions, diabetes, high blood pressure. They become a little bit more arthritic. And so in order for them to maintain their level of activity that they're used to in their younger ages, they need to maintain their level of physical activity, and exercise is a really big part of that.
A lot of people feel fatigued, they don't want to do it, they get a little lazy, but you encourage them to push through that and stay motivated.
Absolutely.
And what kind of physical exercises can seniors be doing right now to improve their overall health?
So for my patients, I always recommend walking. Walking is a great form of exercise. And then you get to go outside, out in the sun, and get a little bit of vitamin D as well. Other than, you should walk at least 30 minutes a day, at least 3 times a week if you're not able to do it every day. Sometimes, patients say it gets hot in the summer and where can we walk? Our indoor malls, we have a lot of indoor malls around here.
Yeah.
Walking inside of the malls is a good idea. Don't forget to stay active at home. Vacuuming, cleaning, all those gardening, all those things and do it a little bit more briskly than usual. That'll keep you active as well. Gyms, a lot of our seniors get gym memberships. And at the gyms, they have things like, pools where they can do non-so weight-bearing activities. The buoyancy of the water helps their arthritic conditions a little bit. We recommend a lot of weightlifting too for seniors, especially things that helps with their lower back, their legs, their joints, their knees. This is particularly important for continuing their mobility, being able to walk long distances and maintaining just their normal active lifestyle.
Even if you got dumbbells, 3 pounds, 5 pounds, and when you were walking, just carry them with you. Would that help?
Absolutely. Anything you do that helps increase your heart rate a little bit, helps increase your fitness, your breathing, all those things will help definitely keep you going.
Now, Healthcare Partners does a fantastic job providing healthcare services for seniors through their Total Care model.
Yes.
What exactly is that?
So our Total Care model just says that we use a really significant team approach. You're essentially getting care coordinators, a whole bunch of different physicians, social workers, all working together to take care of the patient. They're essentially getting VIP type medicine, concierge medicine without the cost is how I describe it. So we work really hard. Our care coordinators are great. Going into the hospital, coming out of the hospital, they're there to make sure everything goes smoothly. I've actually heard of a story where a patient was going into the hospital, was more concerned about their pet than they were about getting better, and so the care coordinators were able to help place the pet in kind of pet sitting services and things like that. So they're really involved. They're a really important part of our Total Care model, making sure that we do provide that high quality care at a reasonable cost.
Yeah, it's very comprehensive. You try to do everything to keep them calm, help them through their medical difficulties.
Absolutely.
Now, can you describe other ways Healthcare Partners impacts healthcare here in Southern Nevada?
So what we try to do is do a really good job as far as taking care of our patients. All our patients in the community, if you come to one of our clinics, will be able to kind of assess and do all the preventative things, talk about diet, talk about drinking water in this environment. And we always are interested in feedback. We want to hear from our patients. So we recommend to walk into any of our clinics, talk to one of our practice managers, go to our website, www.hcpnv.com, and check us out, give us feedback, tell us how we're doing so we can continue to improve the quality of care that we're providing.
And that's really different from a lot of places. You go see the doctor, you get out, and that's it. But you really want to improve the quality of healthcare and continue to improve it, and that's why you ask for the feedback.
Absolutely.
And again, how do we do that?
Just go to www.hcpnv.com and we'll be able to get feedback through the website.
Yeah, and when it comes to taking care of seniors, and falls are a huge thing for them too. So what kind of tips do you have there to keep them strong, their bones strong?
Yeah, so the exercise is a big part. Daily walking, going to the gym, and like I said, working on your back, your legs, all of those things will help keep you physically active and strong, and that's what we find really helps prevents the falls, and especially the hip fractures that occur with falls.
And remove some of the things around the house too, rugs that will slide and things like
home
that.
prevention, and some of our social workers and care coordinators actually go to the home, kind of give you tips on how to do some of those
And
things.
it goes all back to the total care model. Thank you so much.
Thank you so much.
Appreciate it.
Yes.
Again, once you become a patient, or if you already are, give Healthcare Partners some feedback. The 4 ways to do that are right there on your screen. To learn more about Healthcare Partners and find the nearest clinic, visit the website right there as well. Still to come on the